Okay, well, Howard, thanks for linking in. It's an interesting to do this and good use of technology. But how did you find the scientific meeting this year? Because it was very different.
So it was very interesting. It was 2 days actually, either in my house or my backyard, but really spending some intensive time with a lot of the other members of the scientific committee, very, very carefully looking at all the abstracts. And it's a hard decision because we had so many good abstracts. And I think one of the nice things about it is they covered such a variety of topics within what the ICS really stands for. So it was actually very, very interesting. What did you think about it?
Yeah, for me, it's very strange because we've never done it that way before. I felt sorry for our colleagues in New Zealand who were starting at midnight and finishing at 6, but it worked much better than I expected it would. I think because we've such a tight committee. I think that's really the reason it works so well. But it was useful and helpful and worked well. So good thing.
Any thoughts on just the background of COVID in 2020 and your thoughts about the importance of this meeting in such an environment?
And I still think it's very important that we have a meeting. I think COVID shouldn't put a blanket on all scientific activity. I think that'd be a real mistake. Anything in the abstracts that really stood out for you?
Well, so first of all, I thought just the wide variety. I mean, there's almost something for everybody. Some of my personal interests, there's a lot on neuromodulation, and I think we've gotten to the point where it's not only does this work or does it not work, but looking at very specific patient populations and also looking specifically at now specific factors about the current and about how to apply the energy and things of that nature. So I think we've gotten to the next level of really looking at much more specifics of what's going on with neuromodulation. So I found that very interesting. There's also a lot on botulinum toxin, some new forms of the molecule, some new ways of looking at it, and actually some very nice long-term outcomes and sort of what might predict for long-term outcomes. So I think there's a lot of what we've been doing already, but taking it to the next level. What about you?
Well, I thought I was like you. I thought that the peripheral nerve stuff seems to be developing more rapidly than the sacral nerve modulation. I think that I find interesting, and there is a very excellent abstract on the neurological heading, which is a prize winner, looking at a subcutaneous self-contained device with no lead, no tine, and an implanted battery, with 48-week results, and actually stunningly good results if they're correct. People being dry at 30% dry at 48 weeks. So that's very impressive. And I think it all ties in very nicely with the workshops. I like the fact that things tie in with our meeting. So there's 2 workshops on neuromodulation, and there's a good number of abstracts, one of which is a prize winner. So I like that very much.
Yeah, I think it looks like this peripheral stimulation, people have been talking about it and doing very small studies, but we're starting to actually see studies with a reasonable number of patients and with some follow-up. So I think there are a number of them, and I think we'll probably see more of this as it comes along, but it's always nice to see some of these initial results at the ICS meeting, clearly. Yeah. What other particular abstracts did you find interesting?
Oh, well, two other on the urology type of section. There was a large, I think it's the largest series of female urethral strictures. And I thought that was good. And showing, as you may expect, showing that dilatation or endoscopic treatment not as good as urethroplasty, where they use local vaginal tissue or buccal mucosa. And again, that's much as we would expect, but nicely done, good presented with a Kaplan-Meier curve to show how it all breaks down. And then there was another one on the timing of implantation of artificial sphincter. So pre or post radiotherapy, because that's always a question that we're asking. And it's nice to see that addressed. So it seems that if you give radiotherapy pre-operatively, get this right now, there's less atrophy and longer time to review. So that's obviously the thing to do.
Yeah, it's interesting. There were a few others I found. There's a nice study on some of the long-term results of some of the adjustable male sling.
Yeah.
So again, looking at potential or actual post-prostatectomy incontinence from another angle. I thought that was very interesting. There's another one that has a personal interest to me, and I believe is a prize winner, looking at radiation exposure during fluorodynamics. I mean, that's something we think something that happens. I know our colleagues who do endourology and do a lot of stones and have a lot more fluoroscopic radiation, they are particularly attuned to this. But I think a lot of us who do perhaps a little less, but nowadays, during neuromodulation, we're exposed to radiation. During fluorodynamics, you're exposed to these things. So I think it's nice to see something that's actually taking the bull by the horns and really looking at this carefully.
Yeah. And of course, some of our members in ICS have had thyroid cancers, potentially associated with performing urodynamics and using radiotherapy, using X-rays for fluoro.
So I think even at this point we can make a plug for wearing the appropriate lead equipment when you're getting exposed.
Yeah. No, I think that's sensible. What about anything scientific? Pick away at you. Anything? I mean, and we were blessed this year because we didn't just have Jennifer Kruger, who's on our committee. We also co-opted Laurie Berder and Chris Fry to look at these. So we expect good things of them. But the two that stuck out for me was one that looked at producing a mouse model to look at autoimmune response to injection of antigens raised against urothelium. Now that's interesting, and what they showed was there does seem to be a potential for an autoimmune response, at least on a mouse model, that may explain partly Hunner's ulcers, interstitial cystitis. That's quite fascinating. Yeah. And the other one, again, following on from the theme of pelvic pain, using low energy shockwave therapy to treat inflammation in a rat model derived from instillation of epirubicin. And they showed the reduction in IL-6 and tumor necrosis factor. And that's, again, very interesting and ties in with the workshops that are looking at pelvic pain. So it's pretty good stuff.
Yeah, I think it's interesting because a lot of our best abstracts actually tie in unintentionally, but fortuitously with some of the workshops. I happen to like some of the basic science. I happen to enjoy some of the basic science workshops where they were using some new devices intravesically to either monitor bladder activity or even to start thinking about some kind of on-demand neuromodulation based on what's going on in the bladder. And at the same time, when we transition over to the roundtables, one of the roundtables is new urodynamics technology, where I know in that roundtable, besides talking about how to look at and interpret current urodynamics tracings in sort of new ways, using other technology to look at the urodynamics tracings, they also are going to be talking about some of these ideas of putting a urodynamics monitor in the bladder, almost something that not exactly ambulatory monitoring, something that can stay there independently for a while and then just give you a readout after the fact. I think there are a lot of interesting roundtables. Any that caught your fancy?
No, well, I didn't really look much at the round tables. I've got to be honest. You had a better look at them than I had. I spent a bit of time looking at the workshops and the linkages. So it's I'll bow to your reading of those.
All right. So there were a few others that I thought were quite interesting. I mean, there's a lot of controversy in our space now about thermal therapy, laser therapy for various vaginal issues, and in particular for lower urinary tract symptoms. So there's a nice roundtable that's going to go through a lot of the detail on that. There's also an interesting roundtable looking at the use of the robot for surgery in our space. And it's interesting because not only do we have a roundtable that's going to examine that, but when you look at the video sessions, there are quite a few videos where they actually utilize robotic-assisted laparoscopic technology. So I think that's something that's out there, and it's something that obviously we have to address and look at. There's also another interesting roundtable that's more I think probably based on clinical evidence, but also on a lot of the experience of the presenters. And I think the title of it is "The Failed Sling, What Next?" Yeah. That it seems to be that they're going to examine a lot of different cases of you did a sling, for whatever reason the patient is still incontinent. Well, how do you evaluate that patient? Looking at certain circumstances, what might be your next move? So I think there are a lot of different things that are interesting in that area. Any of the videos catch your attention?
Yeah, there's always a lot of prolapse type surgery that lends itself to it, and the laparoscopic and particularly robotic lends itself to that. And there's some very, very good ones. There's one which I won't actually mention the name of, but I thought it was actually quite fascinating, even though I don't necessarily agree with what they're proposing. I think it's going to be very controversial. It's going to be there. It's going to be shown. And I just want people to come along and look at this critically and open up a discussion, because I think that's the important part. There's always two things with videos. There's the quality of the video itself, and this is a particularly excellent quality video. But again, there's a lot of controversy around what they're doing, and I think let's open this into a big discussion, because that should be the use of the videos, not necessarily always on there just to say this is how you should do something. Let's use it for discussion.
That's a great point. And I think there are a number of videos like that where it's a high quality video, and it may not be exactly perhaps the way I like to do things. It certainly makes me think about other options. And at the time of the video presentation, will afford a lot of people time for interesting questions and discussion as to what is the role of this, if there really is a role for it, what is the role? It's interesting, there seem to be quite a few videos also on gender reassignment and different sorts of those types of surgery, which I know there's certainly a growing interest in that. I think a lot of us are less familiar with it, but there seems to be a cadre of our membership who's really taken that one and is really working hard to advance the science in that area.
Yeah, again, I think you're right. It's not something I do. It's nothing I've ever done. I think some of them are very, very good videos, and they'll be of use and interest to, at the moment, a minority group of surgeons. So, but they will certainly serve a purpose. There's no doubt on that. One other abstract which I thought was interesting was I think it came from Korea. It was just a review and meta-analysis of alpha blockers in females.
Yeah,
and I like that because it fairly definitively says that they are of little or no use. And often negative things don't get much press, but it's quite useful because that's generally, I think, how most of us would think about them. They made the point, in fact, that they're little or no better than placebo, which ties in again nicely because we do have a state-of-the-art lecture, which Alan Ween's going to give, on placebo. Now, I have no idea what Alan's going to say about placebo, whether it's going to say it's good, bad, or indifferent, but he'll be interesting to listen to.
So he's always interesting to listen to. So I certainly I look forward to that. And he has a wealth of experience really examining a lot of trials in overactive bladder and has an enormous insight into a lot of how these trials work and this whole placebo effect. I think if you look at a lot of the medications we use for particularly, let's say, overactive bladder, the placebos always do very, very well.
Don't they?
And so it'll be interesting to get his idea of exactly why that is. I think many of us have our own personal ideas, but I don't think there's probably anybody who has the experience and the knowledge of this as he does.
Well, I think it's interesting because we need to be wise enough to say, why does this placebo work so well? And if I can get a 40% response with something which is totally innocuous and can't do any harm, isn't that a good thing?
That's pretty good. I will actually take that for many of my patients, quite frankly.
Yeah. I totally agree. But I think, we're too quick sometimes to condemn things and use the term placebo as a denigration. And we need to be a bit wiser, I think, than that.
Yeah, I look forward to hearing what he has to say.
Anything else outside the abstracts and roundtables take your fancy?
So I think the other state-of-the-arts are quite interesting. I mean, Holly Richter, who's really a urogynecologist of tremendous stature, is going to be speaking about transvaginal hysterectomy. I think there's been a big movement in many places of the world to preserve the uterus. Yeah. And the question at the end of the day is, what are the surgical outcomes when you do that? So it'll be really nice to hear from her. She's studied this extensively, written about it, and she's an excellent speaker. So that'll be very nice. What about, I think there's a third one, Dr. Emmanuel. What do you think?
No, this is something I've got a particular interest in, and I'm very glad that this is going to be a theme running through ICS. So we've had now several state-of-the-arts on the microbiome, but that's related to the bladder. And Linda Brubacher gave a very good state-of-the-art last year in Gothenburg. So this is carrying on the theme, but looking at now not just bowel, but neurogenic bowel. And Anton Emanuel is professor of neurogastroenterology. I didn't know such a thing existed in the University College Hospital in London. So I think it's good to keep this theme running. And now, in fact, that the SOAs are becoming part of the mainstream of the scientific committee to set the agenda, we can run themes possibly easier than we did before. So this is a good one to keep looking at.
Good. Well, let me change gears and ask you, because I have a feeling you've been to more ICS meetings than I have. I've been to quite a few, but for the first time attending to an ICS meeting, what would be your advice?
I think ICS has always been a very family type meeting. I think that's what makes it so good. It's truly multidisciplinary. It always has a feel to me like a family wedding, which I think is not a bad analogy. Do go and see some of the good science. I think that's absolutely important. I think the SOAs for me are the showcase of ICS. So I would make a point of going to see the SOAs and then dip into some of the other really good science that's of your interest. And thirdly, go and see something that's not in your realm of interest. Go and see something that's completely on the periphery of what you do. So if you're a scientist, you're a urologist, go and see something gynecological or something else. If you are a clinician, go and see some good science and try and work out what they're talking about, because it isn't always necessarily going to be easy. But that's how they give a better breadth to their understanding and their practice. So, and it's all there.